So I'm just going to take you on a journey of a citizen in 2070. So we've taken data in Leeds to define what that will look like. So in 2070 in Leeds, we'll have our first citizen aged 120. And she's 64 now. And she's about to retire, and she's still got 56 years to live, which is quite a frightening thought in some respects. We know that she lives in North Leeds. We know how our demographics in the city and how different parts of the city have different lengths of life chances at the moment. We know she'll be called Linda, and she'll be continually monitored by wearable devices and sensors in her home. And her care will be coordinated using an app on a smart TV. And her life plan will be based on her riskogram DNA profile, because as medicine moves on, we're understanding more and more about what our life chances are in terms of our profiles medically. And a medication will be pharmacogenically designed just for her. No idea what that means, but that's what we're anticipating. But really key, actually, is the fact that most of her care will be provided by a local community. And as we all know, we've got an increasing demographic, we've got a reducing financial envelope. And what we're looking at in the Care Act and nationally is around how do we support people to live in their homes longer. So really, this is really the basis upon which we're looking at this. So I've talked you through the infrastructure, and what I'm talking about is this pink area. So what we're doing in Leeds is we're working on a citizen engagement activity. We're not looking at technology, we're working with people in communities, talking to them about what it is that they need. We're working with existing networks in those communities, and it's about that co-production, which is how social work operates, working with people and on behalf of people. And we're moving from passive to active citizens, providing tools to help people to take control of their lives in the future. And we're building outcomes, evidencing through prototypes that we're building at the moment. So as I explained, we're calling it citizen-driven health. And one example is about connecting people involved in the circle of care around the individual, so that we can connect those people together to support them and their well-being. So we're working with neighbourhood networks that exist already across the city of Leeds. And they're community social enterprise networks who enable elderly people to live more independently and to proactively participate in their communities. And those neighbourhood networks actually provide volunteering opportunities for that community, so people can actually support them by volunteering time and effort. And they act as a gateway to advice, information and services to promote health and well-being. So here's some statistics. I'll not go through it all, but as you can see, we've got 32 neighbourhood networks covering over 22,000 older people. Loads of volunteering, and there are real statistics about how they've actually transformed in terms of linking in with safeguarding referrals and supporting people not going into hospital. And that's where they actually are. So what we're looking at is about that coordination of care, and we're looking at that central part, the individual and their circle of care, so their family, their friends, their caregivers, and then linking out to that professional network where they may have a GP, they may have a practice nurse that takes bloods, etc. They may have other people within that clinical link there. And what we're looking at is this is a slide from the King's Fund. I think you'll perhaps recognise it from the video at the beginning. They're the costs of the system. So as you can see, the cost of intervention going into any NHS environment is pretty heavy. So we're working with two different companies to build technologies to support people with that circle of care. We're working with Yeco and we're working with Healthpump or Pumpco. And you'll perhaps recognise that this says Bob, but it could be Sam from earlier. And he's seen by his friends as him as a full person, but he's seen by the healthcare system as his optician, looks purely at his eyes. You know, if he's got heart condition, he'll probably have someone working specifically in that arena. There may be an OT working with him on his ability to move. And what we're looking at is looking at the whole person and how can we support that person within that whole system. And what we see that as is actually going through that circle of social, that curve of social innovation. So we're prototyping, working with real people on the ground to try and demonstrate the value of turning this system on its head by looking at self-management in an area, working with communities, in that video that we saw first off. And we are working with the university to actually demonstrate the value of that and really write that case study up so that we can look at how do we move that forward to demonstrate a sustainable model where it can scale and actually get to systemic change.